Gonna get started here. Just leave that. Okay, I think we're good. Okay. All right. So, hello everyone. My name is Dr. Michael Foti. I'm a third-year senior resident at Greenwich Hospital, and today I'll be talking about preventive medicine. And at the end of the talk, there's a Q&A section there. Feel free to type any questions you might have, and I'll get to them at the end of the presentation. Okay. So just wanted to start with a quote that I think is really a good way to start this presentation. An ounce of prevention is worth a pound of cure, which kind of highlights a lot of what I'll be talking about and how important preventive medicine is to what we do as primary care physicians and physicians in general. So preventive medicine, what is it? So basically, the goal of all healthcare providers, and especially primary care providers, who are the health advocate of our patients, is preventing disease and disease progression. And we do so by promoting healthy lifestyles, uh, advocating for protective measures, which I'll go into, to protect our patients against illness, screening for disease to be able to detect and treat at the earliest stage of disease when these treatments would be most effective, and to treat conditions to prevent their progression going forward as well. So it's layered, and there's several levels to preventive medicine, from prior to disease, early stage disease, and when someone does have a condition that we're treating, we're always still trying to prevent either the condition or the condition from becoming symptomatic or from the condition progressing. So I'll get into all of that. So, starting first and foremost is promoting a healthy lifestyle. So, with our patients, we always want to encourage healthy eating habits, promoting any dietary changes where we could see there's room for improvement in our patients' eating habits, increasing activity level and exercise, which is so important to promote a healthy lifestyle and prevent future disease, and healthy environment, including barriers to healthy living. Again, primary care physicians are our patients' advocates. So if there's any barrier to healthy living, whether that be cost to purchasing healthy foods or living situation, we always try to help connect our patients with the right staff members to help them moving forward to get past those barriers to healthy living, because we don't and we shouldn't assume that a patient just isn't trying to eat healthy or have a healthy living situation. We should always be asking those questions. What is your living situation? Are there any barriers to you eating healthy, exercising, etc., and helping our patients get past those barriers? So it's very important, especially as a primary care physician. Promoting protection. So we want to protect our patients from disease. And this is also very layered. Immunizations, annual flu vaccine. And most recently, which is the topic of on everyone's mind and on news outlets every day, is the COVID vaccination. And then based on specific age groups, the pneumonia vaccine, the shingles vaccine, and your healthcare providers will talk to you about those things. And the goal of these immunizations to protect our patients from illness, and nothing more. And, no immunization is 100%, but uh, some protection is better than no protection. So it's very important. Other things in terms of protection, our patients may have certain risk factors for cardiovascular disease. Hence, we give our patients aspirin as as a preventative measure. For if they're at risk for cardiovascular disease, etc. Certain medicines and lifestyles to help promote prevention of these diseases if they're at risk. And then promoting protective devices depending on one's occupation. As a primary care provider or physician in general, you should always know what your patient's occupation is. Because if a patient's presenting to your office and they have certain symptoms, a person's occupation can put them at risk for disease. And we should know that because it'll help us determine Is that playing a role in this? Also, to protect them from future disease. Let's say they work in an occupation where it's very loud, they're exposed to loud noises. Are they wearing protective ear equipment? Is that being provided to them? These are things that we should be thinking about. We are our patient's healthcare advocate, we are their health advocate, and we should be advocating that their lifestyle is as the healthiest that it can be. So these are things we should always be thinking about, and discussions that always should be had with your physician. And then screening for disease. That's that next step in prevention. So, as physicians and scientists, we've developed screening tools which allow us to detect disease at an early stage, oftentimes asymptomatic, meaning the patient does not have any symptoms, but allows us to detect it at the earliest point possible so we may be able to act on it. And that not might always be with medicine, it could just be a healthy lifestyle, those dietary changes I mentioned earlier, etc., that will help to prevent progression of disease, or tools, imaging, etc., to help us to detect disease at an earlier stage and act on it at the most earliest stage that we hopefully can detect it, where our treatments would be more effective than it would have been found later on, right? So, and these screening tools are based on our patient's demographics, their age group, risk factors, et cetera, where the evidence shows that these are the patients where these conditions are found most, and we want to detect at that earliest stage, right? So that's our goal with these screening tools. And I've just listed a few here to go over. There's many screening tools that for several conditions, and I don't have time to go over all of them. But I wanted to touch on a few as examples to explain what I mean by screening tools and screening for disease for our patients. So one is screening for type 2 diabetes. According to the United States Preventive Task Force, clinicians should screen their patients for diabetes, and all adults who age 40 to 70 by their BMI are overweight or obese. And we do so by several tests. I've listed a few here. I'm sure you might have heard some of these before. Um, One being hemoglobin A1C. A hemoglobin A1C is an average of someone's blood sugar over the last 3 months. So it's not just a spot in time of what my blood sugar is, today at 12 noon after I've eaten something. It's your average blood sugar all day, every day over the last 3 months. And it's a great indice for physicians to be able to screen for diabetes. And the percentage is listed here. As you can see, normal would be less than 5.7%. What we term pre-diabetes would be 5.7 to 6.4%. And that's very important because it allows us as primary care physicians and other physicians, endocrinologists, to be able to detect patients who are at risk for diabetes. And we can promote healthy lifestyles and dietary changes to help try to get them out of that pre-diabetes stage into maybe a normal range, or prevent them rather from going from pre-diabetes to diabetes, right? So it's not always necessarily medicine that we start, but just have a discussion about, what are you eating every day? Is there any room for improvement? Some things we might be able to cut out. How's your exercise? Again, this goes back to what I was talking about before, promoting a healthy lifestyle. Where are things that we can kind of work together to improve on to help prevent progression to diabetes, which would be in terms of a hemoglobin A1C as that of 6.5% or higher. Another measure we have is what's called a fasting plasma glucose. And basically, that is your blood sugar fasting, meaning oftentimes we check our patients. They come in the morning to our office. They ask them not to eat the night before. And without having eaten or drinking anything, what is their blood sugar? Because your body should be able to regulate that. If your body's unable to be able to bring that blood sugar down, but you haven't eaten anything, that's something that might allow us to understand that you might be at risk for developing diabetes. So looking at those numbers, and these are numbers per the ADA, or American Diabetes Association. Normal is less than 100. Pre-diabetes is 100 to 125, and diabetes would be 126 or higher. So things to just to discuss with your healthcare physician once you get these results. Another screening tool is screening for colon cancer. And per the United States Preventive Task Force, this actually was recently adjusted, and that's a discussion you can have with your healthcare provider. But recently, the United States Preventive Task Force expanded screening to those 45 to 75 years of age to screen for colon cancer with a colonoscopy. Previously, it was 50 to 75. The change is that we're finding more people in that lower age group with colon cancer. So we want to be able to detect it earlier and be able to act on it earlier before, let's say a polyp was found, before that polyp becomes, cancerous, or detect it at its earliest stage to be able to act on it at its earlier stage when our treatments would be most effective. And that's our goal. And then adults 76 to 85, it's a discussion between their physician and the patient based on their health, their prior screening history, what have their prior colonoscopies found? Have they've all been normal? Has anything been found before? That might change the decision. And then personal preference, again, that's a decision and a discussion between the patient and their physician. And then the third one I wanted to talk about is lung cancer screening. According to the United States Preventive Task Force, we recommend annual screening with a low dose CT, so CAT scan, for adults who are 50 to 80 years of age, who have a 20-pack year smoking history, and are current smokers, or those who have quit within the past 15 years. And that is to, again, to detect this disease at its earliest stage. Oftentimes, a nodule might be found, and there's other additional recommendations that you can discuss with your physician to follow those up further. And oftentimes, those are, have another surveillance CAT scan, and a certain amount of time after that, depending on what is found. And that's again a discussion you have with your physician. And then the recommendations are also to discontinue screening once a person hasn't smoked for 15 years, or if they have developed some sort of health problem that's limited their life expectancy or willingness or ability to undergo a lung surgery that would otherwise be curative. But again, these screening tools are not in any way to scare our patients. It's to help. We want our patients to be at their healthiest and be able to detect disease at its earliest possible stage. And evidence has showed that certain age groups and certain risk factors put people at a higher risk for disease. And we want to be able to detect that at its earliest point that we can act on it. And that's truly our goal. So a summary, I want to summarize everything I've talked about and then leave room for questions. But primary care physicians are advocates for healthy lifestyles. And this goes, from all stages of disease, because healthy lifestyles can really help prevent and also help prevent the progression of disease. And as I mentioned earlier, so it's very important in terms of having that discussion with your health provider. Where are there room for improvement to help with that and help prevent disease and help its progression as well. Implementing protective measures such as immunizations are crucial to protecting oneself from disease. Again, a discussion to have with your physician, but I know on everyone's mind, the COVID vaccination is on everyone's mind. And so all these types of immunizations are meant to help protect our patients from preventable illness. And whether that be severe illness or not, we want to prevent that in our patients. And early detection of disease is crucial, as it allows primary care physicians and other consultants as well to treat disease at an earlier stage when our treatments would be more effective. And that's why we have these screening tools and why it's so important. So these are my references, and I want to leave room for any questions at all from our attendees, but thank you so much for your time. Let's see if I can access the Q&A here. Any questions at all?
If you're not sure how to put a question in, If you move your cursor down towards the bottom of the screen, you'll see the Zoom bar come up, and there's a Q&A function there. You can just click on that and type in your question, and the doctor will be able to see those questions.
Okay. Well, if there's no other any questions at all, thank you so much, everyone, for your time, and have a wonderful day. Thanks so much.